Hello everyone, welcome to The Social Doctor, and this is Dr. Ayushi. The Social Doctor is a platform for the doctors by the doctors, where we discuss journeys, experiences, and knowledge from successful medical practitioners. And today we have Dr. Aviral Jain with us. He is a Gastro Onco Surgeon who is practicing in the Bombay Hospital, Indore. And he's here to tell us about the scope and opportunities of being a GI and an HPB surgeon. So let's ask him, what does he mean by HPB surgeon, and what are the opportunities in this branch which he's practicing right now. Welcome, doctor, to the platform.
Thank you very much to Social Doctor. And let me start with my introduction. So I am Dr. Aviral Jain. I'm basically a super specialist gastro surgeon, HPV surgeon, and liver transplantation surgeon at Bombay Hospital, Indore, which is in Madhya Pradesh. I am a basically super specialist, dedicated surgeon for the GI surgery, and so the going topic for today is like GI and HPV surgery. And later on my this talk, I will tell you what is this GI surgery and HPV surgery. I'm practicing in one of the big corporate hospital, very famous corporate hospital of Indore, Bombay Hospital, and last 2 year I'm working here. And previously used to, I finished my MBBS from MGM Medical College Indore, and then I appeared for my master degrees. So I did my master in surgery from very famous and very one of the oldest medical college of India, that is Grant Medical College, Mumbai. People used to call it JJ Hospital, very famous JJ Hospital, Mumbai. And I finished my master in surgery. Then I appeared for my super specialization exam, and I got first rank in India. I selected this branch, and this is I selected for first rank. I selected this branch, which is the GI surgery, from one of the best and one of the prestigious institute for gastrosurgery in world in India, that is AIG Hyderabad, Asian Institute of Gastroenterology Hyderabad. And I completed my 3 year super specialty program in GI and HPV surgery. And after that, I was in Mumbai. I was in Tata for 4 months. I finished my observership in hepatobiliary surgery, hepatopancreaticobiliary surgery. And so I nearly like 14 and half year from my MBBS to MS to my super specialty. And then last 2 year I am actively practicing in this wonderful and cleanest city, beautiful city of Indore. And so this is a wonderful journey, I personally feel. And I'm trying to doing good work and good dedicated gastro work, dedicated HPV work for this central India people. I try to cover, I try to tell people about my qualities and my expertise. So I'm trying to, I can tell you, it's my just starting of my journey of my career, but I am trying to propagate my field as a specifically gastro and HPV surgery.
Yes. No, that's nice to know. Actually, you know, nice to know somebody who has opted for this. But, there comes my next question. Why did you choose for gastroenterology other than, so many other fields like neurosurgery and so many other fields? Why did you choose this?
So I'll tell you. So in 2015, I appeared for my super specialty exam, and I selected. I got this branch. I opt for this branch, and reason being for opting this branch, see, this gastro surgery is basically a surgery of abdomen, surgery of the abdominal organ, surgery for the abdominal cancers. There are subdivision like upper GI surgery, the HPB surgery, that is like hepato pancreaticobiliary, means surgery of liver, pancreas, bile duct. Then there is a very different and unique branch which is flowering in India, like liver transplantation. And there is a small subdivision like colorectal surgery. So now this is a very, very, I'll tell you, good branch, dedicated branch where people can have wonderful results. So, people know about neurosurgery, people know about cardiac surgeon, people know about neurosurgeon. But if you ask someone who is not very new to this field, that who is the gastrosurgeon, who is the hepatobiliary surgeon, so he says, I don't know. So that is uh, very new about this branch. So people have, like, if have I have a tumor in my liver, so I can go to a liver surgeon. I can ask for a liver surgeon who dedicatedly do only the liver cancer work. So in future, maybe down the line, next 5 year, 10 year, the pupil ask for the very, very sub expertise. So they want a colorectal surgeon, they want a HPB surgeon, they want a super specialist gastro surgeon who can perform laparoscopic surgery. So this is the future going to be. See, when you go for a shopping, you looking for something which is very unique and special, and that is the philosophy and nature of everyone. So people, a human being, want a perfectness. So if you have any problem related to your brain, why you are looking for a neurosurgeon? Because a neurosurgeon can deal in this problem in a much better way. So that is the similar reason why I opted for this branch. My philosophy, I want to do so dedicated, so unique, and so precise, and once a single down the line work, and that is gastrosurgery, so that I can give much, much, much better result. So this is the refinedness of my work, and this is the quality of my work that I can give through this branch. That is why I selected this gastro and HPV surgery. So I'll tell you about very 2 minutes about HPV surgery, and this is very new, very, very new branch of surgery. I can tell you subdivision of super specialty hepatopancreaticobiliary surgery, where people only do their limited and precise work over liver, pancreas, bile duct, and the tumors, their pathologies, and their physiologies. So there's a uniqueness about this branch. We can target only over these three organs. And I will tell you, in America, there are lots of people are opting this branch. So people want to be only the liver transplant surgeon. People want to be the only hepatopancreaticobiliary surgeon. People want to be only the pancreatic surgeon. So I know there are few good surgeons in India as well who are doing dedicatedly pancreatic work. We have hundreds of organ in our body, like brain. Someone is doing surgery over brain. So there are some surgeon who is doing only surgery over pancreas. So he is now very pancreatic surgeon. The advantage of this sub specialization, when you do one thing regularly on daily basis, you become master of it. So this HPV surgery is nothing but mastering over one subject, and that is the liver, pancreas, and the bile duct.
Yes. No, that's really nice to know, sir. And I completely agree with your point that now things are going into, specialized places. Everyone, when it comes to patients, also are looking for people who can help them and who work in only on specific areas. So that is it's nice to know your reason to pick up this branch. So now if somebody wants to choose this branch, how can a person who is doing MBBS can think of pursuing this?
Uh, Very nice question. So let me start how the medical hierarchy in India. So when someone had done with his or her 11th or 12th class, he has to appear for some exam, that is competitive exam, and appeared for the MBBS. And I'll tell you, this is the starting of the journey for a doctor. So he had to finish his MBBS for around 5.5 years. Then he had to finish his internship, and again he had to appear for one very hard, very tough competitive exam and appear for the master degrees. So see, I am a surgeon, so I can tell you about the surgical branch. So if someone want to be a surgeon, first he has to finish his MBBS, and then he has to finish and clear this competitive exam and choose for the general surgery. So that master in surgery is basically a general surgery, and general surgery is overall meaning surgery of all over the body. So this is a 3-year program which is master of surgery. And once you've done with your master of surgery, MS, so you can have, there are two options. So for this is particularly young surgeons who had finished with their master in surgery. So, see, you can directly go into liver transplantation program without even doing a super specialization program. So, example is that you have to choose a right center, a high volume center, a dedicated center in India as well as abroad, where they used to do routinely liver transplantation. So particularly it is like a sub-specialty of HPB surgery or GI surgery, where you need not to finish super specialty, but you can directly choose to be a liver surgeon and give your 4 or 5 years in learning, and you can be a fantastic and wonderful liver surgeon. So this is one of the way you can go into the liver transplant surgery.
Are
But
there
see,
any, sorry.
most of the people used to do crack super specialty exam, that is super specialization, and that super specialization degree we used to call, it is a GI surgery, gastro surgery. So we can, if we completely, we can call it gastro and hepatobiliary surgery. So you have to create a super specialty need. So you can do your MCH, you can do your DNB, Diplomate of National Board, from a very prestigious institute. So you can again pursue 3 year dedicated hard work over this specialty, which is only the gastro surgery, that is the abdominal part, from what I am eating, esophagus, stomach, to like my colon and rectum. So this 3 year super specialty is the main crux. So you have to complete and got selected for this GI and HPV surgery, whatever it is, like MCH or DNB. So this is the way you have to enter into the field of gastro and HPV surgery.
Okay. Okay, but now when you mentioned before that you can also enter into become a liver transplant specialist after your MS. So how are there courses for that, or you work during, you pick up an institute where get expertised during your work? How does it happen?
Very. So, see, there are courses, I can say, we can call them fellowships, or we can call observership,
Yes.
or we can call a training program under someone, or we can call a kind of degree. And even if we are doing from abroad, we can call getting some form of like degree from abroad. So we can call It is basically a learning program, but we have to give some name. So for example, if I finished my master in surgery and I want to be a liver surgeon. So for example, I can go and do 2-year fellowship under someone, for example, like some very good premier institute in Delhi, for example, Max Hospital or Gangaram Hospital or Medanta, under the mentorship of someone who is doing regularly and routinely the liver transplantation. So I can finish my 2-year training,
Should-
2-year
yes.
training into the liver transplantation. So that is the way we can opt for. See,
Hmm.
this 2 year just an example. See, you
Hmm.
can, there are programs for 1 year. So there are few programs abroad for 3 year. There
Hmm.
are few short courses also. So
Okay.
suppose example, I finished my 2-year fellowship, but still I want to learn something extra and I want to
Hmm.
go abroad. So there are good options like Japan, China, and particularly UK. There are few centers which are wonderful and tremendously dedicated work over the liver,
Okay.
pancreas, and biliary surgery. So
Okay.
you can have add-on expertise. Like
Hmm.
you can go for a 15 days observership. You can go for a 1 month observership abroad, and you
Hmm.
can try to cream your work. See, whatever you have learned here, you can learn extra from that institute.
Yes. Yes.
So
Yes.
there are so many, there are so many sponsors. I'll tell you program like there is a one Society of India.
Hmm.
I was also a member, International and Indian Hepatopancreaticobiliary Society.
Hmm.
They used to give fellowship and I think travelship to other countries so that people can learn
Hmm.
advanced work over this field. So there
Hmm.
are lots of opportunity. There are lots of opportunity, and this is wonderfully growing branch.
Yes. Yes.
People are opting for it, people are looking for it, people are selecting for it. And so when 98, I think around uh, 30 year 40 year back, see, nobody knows about liver transplantation, but now no, everyone is like interested in liver transplantation, that what is new in that,
Hmm.
how you can change the liver of someone. So
Hmm.
there are growing interest in this field,
Hmm.
and this is a very, very, very good field if someone opt want to opt for it.
Yes. 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 That's nice to know. And is there any other, any other fellowship or observership that you can mention or suggest for MS or after your MCH that a person can do in any other branches?
See, for young surgeons, I will tell you something. See, now, whenever you have finished your master in surgery,
Hmm.
you have to decide first you what you want to exactly. You cannot be do all the things. So you cannot be a head and neck surgeon, you cannot be a brain surgeon, you cannot be a GI surgeon, you
Hmm.
cannot be a neurosurgeon, you cannot be a plastic surgeon. So you have to be only one precise work. What do you want to do? And second most important thing, what is your purpose in life, where exactly you want to settle. If someone want to settle at village, or someone want to settle at tehsil place, or someone want to settle at like tier 3 city. And so I think it is not the justifiable if he did liver transplant or very advanced hepatopancreatic biliary work. And because I think it is very difficult to start a setup at these places.
Hmm.
So the main thing is that what the new surgeon want in his career, what exactly he had interest in,
Hmm.
what is his inclination towards which organ. So if somebody want to be a good plastic surgeon, he has to choose plastic surgery. So
Hmm.
once he choose the field, if once he had a vision towards some branch, then
Hmm.
there are lots of fellowship. See, you can be a perfect master of hair transplantation, you can be a perfect master of hand surgery. See,
Hmm.
you there are precise center. For example, these are dedicated burn centers. So there are plastic surgeons who are doing only the burn practice, and so precise and wonderful work by them that over the years and years they are doing only surgeries and work for burn. So this is the precisely you can. So for a young surgeon, my message: first thing, you have to sit down, calm down, and think, what do you want in your life? What is your area of expertise? See, don't go by, see, my colleague is doing neurosurgery, so I want to be a neurosurgeon. Nothing like that. See, you have to understand what is your interest in, what do you want. So I'll tell you, my father want to be me a neurosurgeon, but see, I have interest in my gastro surgery. I want to do pancreatic surgery. So I love doing surgery over pancreas. So I choose what I want to be. I will not select a branch what other choose to be. So
Yeah.
that is the most important thing. And for surgeons and for particularly any field, if you want to be in that field with hard work, you can achieve anything. So most important thing is your orientation, your dedication, and your fineness of work.
Yes, yes. No, that's amazing, and this is really to the point. You need to know what you want to do and where you want to settle. That only leads to selecting something that, and especially specializing in one branch makes all the sense. So now, after you have done your gastrosurgery, so being a gastrosurgeon, what are the job opportunities that have come that are open to you? What are the kind of things that are the best job opportunities for a surgeon like you?
Basically, I am a super specialist, and I moved from Mumbai to Indore around two and a half year back.
Yeah.
And so there are two, three options for a surgeon like me. For example, I can be a freelancer. I can work in every place.
Mm.
I can do my work in every nursing home. I can do my work at every hospital. But there are few pros and few cons of this type of practice. So what I choose to once I have to think, I have to start from some point, and that point I've selected as one of the corporate hospital of Indore, and I
Mm.
started my practice. So I
Mm.
started my practice. I try to do hard work. I try to do all kind of complicated surgeries, and slowly the people start sending me the complicated patient, difficult patient, which used to they send outside the Indore.
Mm.
So they like from periphery near to Indore, example Ratlam, Khandwa, they used to send me patient of complicated abdomens, complicated cancers. So my area of one of the area of interest and area of expertise is cancer surgeries,
Mm. Mm.
GI cancer surgeries, particularly pancreas cancer,
Yes.
liver cancer, colon cancer. So
Mm.
over the time, slowly, I am getting my work from other doctors, and that is how a super specialist grow, by showing his or her
Expert.
good result to others.
Mm.
So there are other options. You can join some of the government setup. See, that is a wonderful work opportunity. You can learn the things. You can serve the poor and needy, and so there are very good opportunity for a super specialist surgeon like me in government setup.
Mm.
So I try to be attached initially with a good corporate hospital. Still, when someone needy come to like some poor and needy, I try to do whatever the best possible in terms of surgery
Mm.
to that patient. And so I'll try to like arrange money from some social worker. I try to blood from some social worker. I try to send that needy person to someone who can help out. So this is the social aspect of a doctor. So, doctor is, see, if you think a surgeon can have only the option of surgery in his life, then I think you are wrong. So he has to attach with the family. When I operate a patient, I have to think of everything. I have to think of finances. I have to think of other family members, other earnings member, and what are the long-term follow-ups. So whenever I come across a patient of, like example, cancer, I have to involve with his interior. I can, so I have to know each and everything about that patient, from like what is his wife is doing, how many kids he has. So this is very important aspect, important human aspect of a surgeon, so that he can give 100% and best result.
Yes, yes, yes. No, that's true. So now when you mentioned that, there are some pros and cons of going into, private practice of your own as well as the corporate. Can you mention a bit on that? Why did you opt for corporate even when you think that, you have multiple options of being on independent?
So this,
What were the cons for that?
no, see, it is, we can have like hours and hour discussion over this topic, but see,
In brief, yes.
there are pros, there are pros and there are cons. Like, for example, if I have to work in a corporate, so many times they have policy like I cannot do outside work.
Yes, yes.
Whatever work, whatever surgical work I'm doing, I have to do under one roof.
Mm.
And that is one of the, I'll tell you, cons of a
That's all.
surgical practice, that if someone is in need of my work outside my institute, I cannot go. So there are examples, but there are advantages like, see, whatever you have to do is you have to do under one roof. And see, you have to not like run from here to there. And this is one of the best advantage
Get a good, ecosystem also.
and doing work. You know, sorry.
You get a good ecosystem also to work, in a corporate.
See, yes, yes. See, I'll tell you, for a surgeon, see, the work environment should be very perfect. See, he cannot do a hassle work. See, he cannot run like, from one hospital to other hospital. So, so I'll tell you, this is a very controversial and long topic.
Yes.
See, you can have debates over it. See, if
Mm.
someone who is doing practice in a government setup since last 5 years, he can tell some pros of that institute, or
Definitely.
someone who's doing like freelancing work, he can have some pros and cons. So if I'm doing like 2.5 years, I'm working in one hospital, I can have something. So this is a long topic, so I think this
I
is not
agree.
the right time to talk about.
Okay. Perfectly, completely agreed with your point, sir. So now, as we know that you are practicing in Indore, despite, being a super specialist, with maximum people after doing the super specialization move towards metros and try practicing there. What was your reason to settle down in Indore, and what is the scope of a super specialist in in a tier 2 or a tier 3 town?
Mhm. So, see, I can say very proudly, Indore is now nearly going towards metro,
Yes.
but not like Mumbai, but like it has population of around 40-50 lakh.
Hmm.
And see, like for example, if I'll say there are hundreds of GI surgeons in Delhi, but I'll tell you there are only few super specialist gastro surgeon in Indore.
Hmm.
So I can see the purpose of coming here, because see, my family is here, my parents are here. So one of the reason I have to start a comfortable career, starting of career from place where I am comfortable, my family is there. And second, see, my second purpose, see, you have to come to reach people. So the people will need you. See, people will need your expertise. So see, if someone had a problem, he every time cannot go to Mumbai, Hyderabad, Delhi. So if I can avail the similar treatment like Mumbai and other big metro city here in Indore, so obviously they will not run to these metro city. So I try to provide the similar quality of surgeries, similar dedicated liver work, similar dedicated pancreatic work here in Indore. I'm trying. I'm not saying I'm doing. I'm saying I'm trying. So
Mm.
maybe in years like 2 year, 3 year, 4 year,
Mm.
I will able to serve so that people have faith in me and they will stop going to the metro cities.
Mm.
And see, once you do all this work, people from third tier cities, like people from Tehsil, and like where the population is 10 lakh, 15 lakh, or 5 lakh, they will move to these cities. And see, if we waste, see, we are financial deprived country. We, for our health, we don't have too much money. So
True.
if I spend all my money in traveling and
Mm.
like staying and going here and there, so
Mm.
it is very difficult. So everyone cannot afford to go to Mumbai or Delhi or Hyderabad or Chennai or Kochi. So that is the expansion of super specialization, super specialty field into the periphery. So
Yes.
someone
Mm.
who had super specialty can move even tier 2 city, even tier 3 city, and start his or her practice and give good result, start his own setup, show good result of hers or his surgery, and then
Mm.
with the time the people will come to you. This field require patience
Mm.
and truthness, the truthness from the surgeon towards his patient.
Yes, yes, that's true. Every field in in the in the medicine needs truthness towards the patient that you're treating. That's very important. So that's so much of knowledge that was so insightful to know from you, doctor. It was to the point, straight from heart, what exactly what you really feel. So anything motivational that you want to tell the students who are studying in MBBS as well as MS, how should they go forward in their life, something that has been a key principle for you, something that they should follow?
So I used to do a few talks also. If you go can see my Facebook pages. So my only message, young budding doctors or MBBS or surgeon, is that they have to come in this field not to earn money. See, this is again a doubtful, debatable, and controversial sentence I am saying, but I am saying it from my heart. Believe me, I am saying it from my heart. If you want to earn money, don't come into this wonderful field. So, coming to this field, going to be a good doctor or going to be a good super specialist surgeon, your first and most important purpose is to help other. My philosophy of my life, the day I have not helped someone who is in need is a wasteful day of mine. वो दिन जब मैंने किसी की मदद नहीं की, वो दिन मेरे लिए अच्छा नहीं है. I have not done something good in that day. And
Hmm.
that is true for a doctor also. So
Hmm.
the intention for a doctor or a surgeon or whatever it is to
Hmm.
help the needy.
Hmm.
So if you do this from your heart, and at the end of day, whatever the result, see, many a time I operate a patient and after 2 3 days he died. But see, that is not in my hand. Many a time the results not in my hand. I try to do my best. I give my best surgery,
Hmm.
but in spite of that, patient succumb to that. But see, from my base of heart, I know that I did a fantastic and right job,
Hmm.
and that is the most peaceful thing. So for a young budding doctor, come to this field if you think
Hmm.
you can really want to help other, you want to serve the humanity. See, money is not an issue. If you do good work, money will come. So your main primary motivation and intention is to help other, and that is the most important message from my side to young budding doctors.
That's even even more nice to know about your key principle. It's something that I completely agree that everybody the budding doctors should have this in mind to help everyone, because I also agree money definitely flows if you are doing good. It's what matters in your life is helping everyone. Thank you so much, Dr. Aviral, for this insightful and amazing discussion. I'm sure many of the budding doctors, the MBBS, the MS people who might be confused or looking for some guidance must be, must have got a track and must be inspired by you, by your achievements, and by things that you have told them to pursue. Thank you so much for this insightful discussion. I'm, really grateful for this. And all
Thank
of
you. Thank you very much. Thank you very
yes,
much for inviting me. Thank you very much.
yes. So, and all of you who have been watching us, thank you so much for being live with us at this time. Do share it with your friends and colleagues who you think will be helpful for them, as well as do follow our Instagram and YouTube page. You can find all our old videos in there, which might also help you. So do follow us there, and actually do stay tuned for our future coming videos. There are some really interesting and insightful videos coming up every Sunday and Wednesday. Sunday 11 a.m., Wednesday 9 p.m. Do join us every time for insightful discussion of this kind. Thank you so much, Doctor.
Thank you.
Yeah.
Thank you. Thank you. Good night. Good night,
Good
everyone.
night.
Thank
Good
you.
night, everyone. Bye-bye.